Rib remodeling ready? These are the don'ts of rib remodeling recovery, and I'm going to guide you through what not to do. My name is Samantha, and I am a post-op provider in Chicago, Illinois, and I underwent the rib remodeling procedure with a reverse tummy tuck as well. So I'm going to start off with don't expect to get real good sleep with this. So with any other procedure, the first week is really hard with sleeping, so don't expect to get a real good sleep, all right? If you do, congratulations, you're one of the few. Number two, don'ts are do not go back to work too soon. Now, I have a very active physical job, and I went back to work in 2.5 weeks. So Dr. Azizi mentioned I would probably be able to go start at 2 weeks or 3 weeks, depending on how I was feeling. I felt fine at 2.5 weeks to go back to work. I did feel my bones moving around at that time. It was extremely necessary for me to wear the Velcro belt while I was working to make sure that my bones weren't moving around. The first week that I went back to, I did feel it moving around. And then as the weeks went on and on, they started to heal better. So just don't go back to work too soon, especially if you have an active job. If you have a sit down at home job, you'll be fine going back early, okay? So that brings me to number three. Do not do this procedure alone. Get help. I mentioned in the first one is like the do's is get help. This one, I'm gonna mention it again. Don't do this by yourself. You will need some help, okay? At least for the first week. 4, do not compare your results to anybody else, all right? Now, there's girls that had reached out to me on like TikTok, and they mentioned to me that their ribs were not shrinking as fast as mine. Guys, our swelling, depending on what we're eating, how we're moving, just genetics too, some girls will shrink sooner than others, okay? Don't compare your results to anybody else. You will get there. If you are doing the waist training, if you're doing the corset, if you're wearing it consistently, your bones will mold to the inches that you want to get to. You just have to be consistent with it. And if you're going faster than others, that's great. If you're going slower than others, you'll get there. Don't compare yourself. Nobody's the same in their healing process. And that goes across the board with all procedures. All right, so number 5, do not twist your body. All right, so you're going to want to pivot your body, not twist your body. When you're moving those bones like that, they're gonna move as well. All right, and your muscles are gonna be inflamed back there, so it's gonna hurt. So try not to do that, okay? And lower your risk of another injury, all right, or fracturing that bone all over again. Pivot, don't twist. You will be using a lot of leg muscles with this, okay? So be prepared for that. There's gonna be like a lot of squatting, all right? Instead of leaning over, bending over, there's gonna be a lot of squatting, okay? So just be prepared for that as well, okay? So don't twist and pivot your body. Number 6, and I'm gonna do a completely separate video for this as well. This is do not be in a rush to get massages done, okay? So if you are getting a rib remodeling procedure alone or maybe with a reverse tummy tuck, I would suggest wait at least a week, and within that first week I highly recommend avoiding, and I'm a massage therapist and I'm telling you this, avoid the area, because the main focus with this procedure is not swelling. You're gonna swell, you have to swell, okay? The thing that you need to be concerned about with this procedure is making sure that those bones are stable, and having somebody rub in that area, move those bones around. You don't want to be doing that. Even getting on and off of a table at that point and taking the waist trainer off within that first week is, I don't recommend doing it. I didn't want anybody to even touch me for the first 3 weeks, and I didn't. And I think that it is way more important to keep the waist trainer on. I know it's way more important to keep this waist trainer on, the corset on, make sure those bones are stable. That is the main priority with this healing, okay? So get those bones nice and secure. And now if we're going to talk about a combo procedure like a rib remodeling with a liposuction, that I recommend go ahead and get the massage, get it on early with the liposuction, okay? And get manual lymphatic drainage. And you have to go to an experienced provider for this, guys, because you can really hurt yourself. And I'm not talking about with the massage alone that they can hurt you. Providers can hurt you getting up and off of a table. I couldn't even lay face down and use my back muscles with this procedure. I had to lay face up the whole time for weeks, so about 2.5 weeks or about 3 weeks, and I was able to lay on my side. But even that was hard to do. So hopefully your provider will have an electric table where the back can come up, and you can be adjusted properly, or hopefully they know positioning really freaking well, because you don't want to hurt yourself. All right. So number seven is do not be going to parties. Okay. If you go to parties and right before your surgery, and you go ahead and you get sick, all right, you get that COVID, you get that little cold, you get a little sniffle, a little sneeze here, that little sneeze is going to be hurting you big time. All right. So sneezing, coughing, those type of movements with the diaphragm and expanding the ribs like that, that will hurt you. It's not gonna be comfortable. Okay. So I highly recommend don't do it. Just keep a low profile right before your surgery. Okay. So that brings me to number 8. Number 8 is make sure if you're 45 or older, you are getting a DEXA scan. And if a doctor is not asking you for a DEXA scan at 45 years or older, don't go to him. Point blank, period. Just don't do it. The DEXA scan, when you get about 45 years and older, needs to scan for the bone density to make sure that when the doctor fractures your bone, that it will heal properly. And they really need to see that. Okay, so the doctor doesn't ask you for a DEXA scan and you're 45 years and up, that's a red flag. So number 9, be patient. I remember the 3rd day I took a shower and I looked at my measurements on the waist, and it was basically where I started pre-surgery. I was still at a 27. And I was like, well, damn, I hope this gets better. And of course it does. But just remember, okay, guys, when you're measuring yourself, especially early on, you're going to be swollen. So be patient with it, and you will shrink. And make sure you're wearing your faja, your foams, your corset, or your waist trainer with a Velcro belt. All right, so just keep it patient, and you will get those results. Number 10, do not be cheap with your supplies. Like I mentioned, you're gonna need foam, get the foam. You're gonna need fajas, get multiple fajas so you're not wearing the same faja every day, okay? That can lead you to yeast infections, bacterial infections, guys. Just get multiple fajas, clean them, and wear different ones throughout the week, okay? Keep it nice and clean and sanitary. And also you're going to want to make sure when you do get your massages, make sure you're not getting like Sally down the block, okay? That's just like somebody's auntie that is just giving massages, okay? Like invest in somebody that's experienced that can actually help you through this, okay? That's very important. So don't be cheap. Get your rib remodeling. Guys, I will be giving more videos on this. Like I mentioned, like there will be a positioning video, there will be a massage video talking about the do's and don'ts for massage, when to get it, when not to, and the reasons why we get massage or we don't get massage for rib remodeling. Rib remodeling is a very different procedure than any other procedure that I have been through, in good ways. Yeah, mostly everything has been very positive with this procedure, although it is very new to the US. I'm glad that I got it. I'm super happy with it, and it really wasn't even that painful. So I think the main thing, guys, here that you really want to do is understand this procedure. If you want to go through it, understand it very thoroughly, what they do to your bones, and get a very good doctor, okay? Other than that, everyone, like and subscribe to videos, and I will continue to make these videos because I know there's not a lot of remodeling videos out there. So I'm trying to get these for you girls. All right, so that's what I got.